that information that is pulled from PeopleSoft and everywhere else. So, if I click the student's name, which I'll do, it pulls up that person's profile within Starfish. Every person who is connected to this student, in whatever capacity in Starfish, can see the same information within that student's profile. You can see the courses this person is taking. You can see any information that has been posted by other people. This person doesn't have much. Let me find someone else that does. Okay, so you can see this person's list of courses that they've been taking, the instructors for those courses, their grades for those courses. If this person has met with their advisor and the advisor has posted notes to the student's profile in Starfish, you would see these notes in this area as well. And these can also be raised by certain tracking items. Okay, so I keep saying tracking items. What is a tracking item? A tracking item in Starfish, there are three main tracking items right now. They're called flags, kudos, and referrals. A kudos is positive feedback. It's something that if a student does well in your class and you want to give them positive feedback, it's just a very simple mechanism for you to do that. If this first student was, did very well on a quiz in the class, I could send them a kudos and say, hey, great job, you did very well on the quiz. And they would get an email with that feedback in it, and then it would also be posted to their Starfish profile, so maybe a future instructor could see, hey, this person did pretty well on their test, this person might not need very much additional help on the side. So basically, kudos is just a positive feedback mechanism. Whenever you send that, the student gets an email notification with the details of that, the class, any extra comments that you might add, and so forth. So kudos, again, positive feedback. Flags are very similar to kudos, but they are not so positive. These are items that might be concerning to you as an instructor or as an advisor or whatever your role might be. If you raise a flag on a student, that means they're not doing so well. They have a problem in the class, for example, maybe an attendance issue. If someone is not coming to class very often and you need to maybe contact that student, or you just want to have a record that that student has not been attending so well besides some kind of attendance roster, you could raise a flag on a student. And let me show you how to do that. If you have your roster pulled up for whatever list of students you're interacting with, there are boxes to the left of the name. So just click the box, and you can do this for multiple students at once if you wanted to. And then you would click the type of tracking item. I mentioned kudos. Let me show you that. It's not letting me, I think because we're between terms right now. Basically, if you check the box next to a student and click kudos, it's going to give you a list of types of kudos that you can attach to this student. It'll say, good score on the exam, good attendance. You have a few preset options that you can choose from. And then you would simply type in some comments, click submit, and then that goes to the student and posts to their Starfish profile.
If you do multiple, do the other students see the other students?
No. Starfish is built for student privacy, so anything that you do for multiple students, the other students in the class won't have any idea what you've sent, unless you actually type in specific names in the comments area within that.
Is there a way that you can get a copy back telling you who you sent it to? Because I've used it before to notify people of something and use the multiple, but then I can't find proof that I did that.
Okay, sort of. And the area that I'm in right now is the tracking tab. You have two tabs within the students area. Like I showed you, my students is where you specify the roster that you're looking at. The tracking tab, it's similar, but these are only items that you've raised on students. So if you raise a flag on a student, you should be able to find that specific flag here. This is not so much individual students as it is individual tracking items. So a student might be listed in this list multiple times for different reasons. Flags, kudos, attendance issues, whatever it might be. So you should be able to see those within your tracking tab in the students box.
If you accidentally flag the wrong student, can you take that flag off?
Yes. Any student with whom you can interact, you can actually change or alter or add information to any flags or kudos that are attached to that student's profile. For example, right now I'm in the tracking area and I see all these students who have had tracking items attached to them by other people, instructors, advisors, so forth. So this first one here, this student, this is a flag and it's called recommend drop. So this student's instructor thinks that the student is not going to be able to be successful in the class and they recommend the student drops the class. So this flag was raised on this student. Now obviously I'm not the instructor for this class, but I could clear off this flag. I could add more information to it if I was a student's advisor. I could go in there and add comments on the flag saying, I met with this student about this issue. Hopefully they will improve or whatever it might be. So if I wanted to clear off that flag entirely, I would check the box, and in this box up here, this area up here, you have an option to resolve. If you click that, that will clear off that flag. It'll just basically make it inactive. A record will still be on that student's profile that that flag was raised, but it won't be active anymore, so it won't show up as a current issue for that student. Does that answer your question? Okay. So again, in this area, in the tracking area, you have just a list of students who have had these items raised. You can limit this to, with these, you have a filter option here. If you just wanted to see flags and not kudos, so just the negative types of things, you can open up a filter and just specify the type of tracking item that you want to show up in this area here. So you have a lot of different options in what you see here. So in this sense, Starfish is really a collection or a database of extra pieces of information beyond PeopleSoft, beyond just student details. This is about performance in classes, attendance. There are other types of flags beyond simply classroom issues, such as there's one called non-academic achievement concern. Non-academic concern, or something like that. And that is basically for things like Kelly was talking about, counseling issues. If you have a student in your class who might be concerning to you, you think they might need some counseling or just need an extra hand with things outside the classroom, there's a type of flag for that you can raise on the student, and someone in the counseling center would actually receive notification of that a student has been flagged for that certain type of issue, and then they can follow up with that student and do what they need to do on their end. Very similar to that, so you have flags that are not positive. These are items that concern you in the classroom. You can also refer students for different issues, and it's very similar to flags. You would simply check the student's box, click the referral option, and this window here is similar to what you would see for flags and kudos. You have certain types of referrals that you can select. The first one is tutoring referral, and there's advising, financial aid, and then the non-academic concerns I mentioned. The difference between flags and referrals are that flags simply send a notification to the student and it posts to their profile, and that's really kind of the end of it. With referrals, whenever you refer a student, that also initiates an email notification to someone else who is designated at the college to be the recipient of this type of tracking item. So we're working on this right now because we do have a few issues with positions at the college. For example, the tutoring referral. We don't have a specific person in that role who would receive these notifications, but we hope to have that nailed down pretty soon. Other things like advising referral, financial aid referral, those types of referrals will send an email to someone in the advising center or the student's assigned advisor if they have one. The financial aid referral would send a notification to someone in the financial aid office, and again, that sort of makes that connection for the student. And it's better than saying, hey, so-and-so, you need to go see your advisor. How many times have we said that? And you sort of wonder if that ever happens. This way, if you raise an advising referral on a specific student, that student's assigned advisor knows that the student has been referred to advising, and they can actually initiate contact with the student to follow up on their end too, instead of just trusting that that connection actually happens after you and the student part. So that's the issue with referrals. Similar to flags, and these can be, usually these are going to be less positive things that students might need help with. outside of the classroom. And then also as someone who is connected to the student in some way, especially as an advisor, this is useful. You can go into your advisee's Starfish profile and see all these other see all these other flags and referrals that have been made to that specific student. So, for example, at the first of the year, if you're meeting with your advisees, or if you are meeting with your class for the first time, whatever the case might be, you have your list of students in front of you. You can go into Starfish, go through your students and see what issues they may have had in the past, already identify which students might need some extra help as you move forward in the year, and just sort of be prepared for your class rather than having to stumble through the first few weeks and find out, okay, these students are okay, these students need some extra help, and so forth. From the Starfish interface, you can do a few other things besides raising tracking items. You can also just contact your students from here. If you check the boxes for all the students or just certain ones, you have the option to send a message, and it's just a quick email to your class or to the students you've selected. And you can say whatever you want to. It's very simple text-based email. You can place notes on student accounts, on student profiles. If I wanted to say that I had met with this student in an advising session and they're considering changing major or whatever it might be, you can check the box, click note, and that's just sort of a tacked-on note on their profile with just some extra information that might be useful to the student's advisee or advisor in the future. If they do change majors, it might be useful for the student's instructors, whoever they might be. And then you can also go back and refer to your notes that you've placed on the student in the future as well. So if you're working with a student over the long haul, and you want to go in there and maybe refresh yourself on what has been an issue in the past, things like that, and you'll have these notes attached to the student profile that you can then go back and see later on. Eventually, we'll have access to a few more features here. The success plan. This is an item where we're trying to get JCTCS to let us post APPs rather than having these on 100 different computers as a student changes majors and so forth. A success plan could be where their APP is posted in Starfish. That way, anyone who works with a student could go to that student Starfish profile and access the most up-to-date APP. Hopefully, we'll have that in place sometime this year, but it's not in place right now, but we are working on that too. That is really the crux of the My Students and Tracking area. Again, these are where you can find student information, basic information, contact information, student IDs, students' class schedules. You can also find information that has been posted by their advisor or their instructors about the student's performance in the class, other issues that might affect their academic performance in your class. So other information beyond PeopleSoft that might be useful. You can post it here, and we have a sort of a database of student information that will allow us to better assist students. And as we're talking about Starfish, it's important to know that the more you use Starfish, the more useful it becomes to everybody else. If no one uses Starfish, we just have the same information that we have from PeopleSoft in this other area, which is not very useful. If more of us use Starfish, we have more information about specific student performance. We have a better early alert system because we can go in at the very beginning of the term, find out which students have been concerned in the past, which students might need extra help. So it helps us to have this early alert system if you use Starfish more. So right now the challenge at Jefferson is to try and get faculty to try this out, get some use out of it, and then also start to collect this information about our students. Throughout the semester, you will get emails, if you haven't already, about things called progress surveys. And a progress survey is simply a little campaign to try and get faculty and advisors and staff and everybody else to go in and do some things in Starfish. All it is, it's just like a little campaign to remind you to go into Starfish and raise tracking items, maybe do some kudos, give some positive feedback, all that kind of stuff. So if you do get emails about that, that's all that is. It's just an extra nudge to use Starfish and to try out some things in there. And usually we'll have, I think, 3 to 4 progress surveys throughout each semester. So if you do receive multiple emails about that, that's all that is, just a reminder to use Starfish. If you're already using Starfish throughout the semester, that's not anything extra. It's basically the same thing that you've already been doing. So If you do get emails about that, that's all that is. The very last thing I'll show you is the services box up here. All this is a big collection of all the different types of services that are available to students across KCTCS. And this is a very big list. It might not be the most useful place to find this information, but every college has several different office contact information posted in this area. So you have to, I think Jefferson is on page like 7 or something like that. So it's not the most useful because, again, this is a system-wide thing. You have to kind of dig for the information you need. But if students do need extra kinds of services, or if you just need to find a place where you can pull some information like advising contacts and so forth, you can do that in the services box. But again, really the main part of Starfish, the most useful part and the most important part is within the students menu here. Just click that, and that's all the useful things I've been showing you for the last few minutes. I think I'm about out of time, but is there any question, or are there any questions before I close up? Okay, like I mentioned, throughout the semester we'll be having some trainings. We try to do those on every campus, a few at the beginning and at the end of the semester. So if you would like some more training on Starfish, feel free to come to any of those sessions that we have. We'll have that information out pretty soon. If you ever have any individual questions about Starfish, feel free to contact me. I'll be glad to answer whatever I can. And that's about it. Thank y'all very much.
Appreciate Adam Elias taking this time to come and talk to us about this today. Thank you so much. We have one additional short presentation before lunch. I did want to make one comment. I taught a class in the fall, and I used Starfish for 3 different messages I sent my students. I had some students whose attendance was looking problematic, and there was a message that I was able to flag those students and automatically send a message out to them saying, I'm concerned about your attendance, please see me, or let's talk about this and see if we can't keep you from being unsuccessful in this class, that kind of a message. I had another message that I sent out to students who were submitting their homework late, and I just picked out the students that hadn't turned everything in that was due, and I sent it out to them. I immediately got a response back from one of the students with all of her missing homework attached to it, so it worked. And then I sent out kudos to the few students who were doing great in the class. But it was a real quick, easy way to send them a personal message to their inbox from their instructor saying either you're doing great, keep up the good work, or you're lagging behind and I'm concerned about you, or you need to talk to me about your attendance problems or something like that. So it really does have great potential for helping us to improve our connectivity with our students. Debbie?
I just have a concern about sending the message. I've used the kudos, it really was good. But sending a message, if like I'm going to refer them to financial aid or refer them to counseling, do I need to let the student know that I did that? Or is it, I have a concern about sending them someplace else without them.
It's my, and I'm going to ask Adam to help me with this, but it's my understanding that those referral kinds of things are still in the process of being set up. Is that right, Adam?
Right, yeah, we're setting those up right now. Hopefully they'll be in place before the semester starts in the next week or so. But if you do a referral, the student still gets notification of that. So they're aware that they're being referred whenever you do that.
So that would be the answer to the question. They would be aware of the fact that you have referred them to somebody else, once it's all in place. But again, that's still being set up right now. Okay, another question?
Well, I just have a question related to that, and you may have said this and I missed it. If an instructor refers somebody, is the onus then on the department to contact the students? Or is the student supposed to contact them? Because if I was
Did you hear the
a student
question?
and I got a message that I had been referred to financial aid, I'd be waiting for them to call me.
Right, well, that's something that we're still talking about, and that's really why we've kind of waited to do this referral piece until
Okay.
now. The way that we're thinking is it's going to be on financial aid to then reach out to the student, which workload issues might come up with this,
Yeah.
so that's, it's still a work in progress, but
Okay.
eventually we hope to have that
Okay.
worked out, so.
Okay, thank you very
Wait a
much.
minute.
Oh, one more.
Did you
Betty?
answer my question about the email? If you did, I missed it. Like when you send the kudos, do you get an email back saying, these are the people you sent it to?
You can see that in the tracking item area. You can see which ones you sent it to. You won't get a notification that you sent the kudos, but you can see what you sent in that tracking item area. And I can send that.
Do you have to go to each individual student then?
It depends. You can pull up a roster. It depends on the connection. If you want to pull up all your students in one class, you can do that. But yes, you can also pull up by the type of tracking item. So just see the kudos that you sent out, just see the flags that you've raised and so forth.
Okay, thank you.
And in terms of documentation, because I think that was a piece of your question as well, what I did was when I sent out those messages, I was able to run off the screen and save it. I was able to for my own documentation so that I could track how many, because part of our H2P initiative involves this intrusive advising of students. And so in order to be able to track it for the grant purposes, I was able to run it off.
Did you print it out then?
I printed it and, and then sent it to our data manager for the grant.
Like it's useful, I think, when there are a group of people that you need to send a notice to, like you need to come for a test review or something like
Right.
that.
Yes,
So I have a preview.
and that's good documentation to have.
Yeah.
Okay, thank you again, Adam. And we need to move on here now. We've got, I've asked our two division chairs, Eva Altman, who's Allied Health Division Chair, and Sonia Rudolph, who is the Nursing Division Chair, and both of whom are co-program associate project managers, something like that, for the H2P grant, which we've talked with, I think, all of you about at some level. But I asked them to provide an update for you today and give you a kind of a status report on where we are on some of the critical components of that grant. So I'm going to hand them the microphone and ask them to close out our morning session.
Good morning, everybody. How are you doing?
Good morning.
We basically want to take a little bit of time to give you an update on where we are with core curriculum. Some of you heard of the H2P grant, some haven't. So I'm going to start out with a little bit of an overview of what the H2P grant is and what this means. The H2P grant, Health Professions Pathway Grant, is a Department of Labor grant. It's a TAACCCT grant. What that means is when businesses were being moved overseas, there was a law that was passed that any of those businesses had to set aside a certain amount of money into a pot. And then people have lost their jobs through those companies moving, were able to be certified as a person who lost a job from one of those companies to receive some of this funding for retraining into other areas. The H2P grant is a consortium of 9 different community colleges in the country. We have 5 states recognized: Illinois, Kentucky, Ohio, Texas, and Minnesota. So we have a lot of different diverse colleges. We have urban, we have rural, we have large, we have small. So it's a good mix of different community colleges that are all working on some of these same initiatives. There are 8 core components that we work on with the H2P grant. Online assessment and career guidance and prior learning assessment. This is an area we worked on with the Virtual Career Network. It's an online exploration tool that students could use to look at their interests, to look at programs that they may be interested in. They can even practice for things like the placement test in math and reading. And this was all part of the grant's work. We also looked at different ways we could give prior learning to students. We have some students who have done portfolios. We have some students who have done challenge exams so that they could get credit for things that they've already done. We also worked on contextualizing developmental education. We had a team of allied health and nursing along with a team for math that worked to develop a contextualized developmental math course. That way students, when they're in the developmental course, could actually do problems that were related to healthcare fields. Those problems were more relevant to them, to their interests. And they had, I think their first class was 100% pass rate. So they had some really good results from contextualizing those courses. Then before the contextualized courses, those courses had about a 50% pass rate. So it was a significant improvement. We also worked on the competency-based core curriculum. We're going to explain that a little bit more in a few minutes. Industry recognized stackable credentials in programs like medical assisting, where they can earn 5 certificates on their way to their associate's degree, or pharmacy tech, where they can achieve certificates in different areas on their way to their degree, to give students a pathway along the way to earn credentials to their goal. Enhanced retention support. We've been lucky enough to have a wonderful success coach, Margo McGowan, who actually did more intrusive one-on-one advising with students, helping them hook up with resources they needed, and helping them to be successful in their programs. We also had some training programs for incumbent health profession workers. We had some medical assistants that were working in community office settings who didn't have their certification or their training to be certified medical assistants. So we partnered with Norton Healthcare in order to bring those students to the college into the medical assisting program and complete the program and their certification. We've also worked on enhanced data and accountability systems and how we're tracking the success of the grant. One example we just talked about was Starfish. How are we showing that we're documenting that we're supporting students and helping them to be successful in the courses? And then again, galvanizing a national movement to improve health professions training. The grant wasn't just about making sure that we try these new things, but looking to see what worked and then taking that to a national level to where it can be used at community colleges around the country. So we're going to talk a little bit about the core curriculum. And a lot of people say, well, why do we need one? We looked at a lot of the information we're receiving from employers, and we found that there were some things that they felt that students didn't have when they came out of our programs that they felt that they needed. So we brought everyone together. That gave us a chance to kind of get some input from our employers on what they felt that they needed that we weren't preparing our students with when they graduated. So you can have a better prepared entry-level workforce if students have had these courses, not only for our selective admission programs, but also for people who are going into very entry-level positions. If you have someone that's going to work in dietary, for example, having some healthcare background information makes them more efficient at what they're doing. And we do have some employer partners in the community now who are recognizing this certificate as a way for them to identify those stronger entry-level employees. In fact, one of our local hospitals, Norton Hospital, is working to include into their hiring postings that preference would be given to students who have completed the core curriculum certificate. So we are seeing that they're recognizing the value. They helped us to devise these courses from the beginning, and now they're seeing the value of what it can do for their new level employees, and actually putting that into practice as preference for hiring. It gives them a solid foundation in safety, teamwork, solid foundation in things like medical terminology, basic skills, which is akin to the M&A skills, pathophysiology and pharmacology. While they may not be the discipline-specific areas within those, for example, with pharmacology, you could have someone that comes into the program, nursing as an example. You may not know all the nursing implications, But imagine how much more time you could spend with your student on those nursing implications if they already walk in the door and they know classifications, examples of drugs, and basic things to look for in those classifications. We have worked on some of the courses to be taught with allied health and nursing together. So it's really helped to break down walls and silos. You know, traditionally everyone's so busy, you're in your area and you don't have that much time to get out into the other areas and work collaboratively. So with these core classes, we have had some team teaching that's really been able to show students before they leave the school, this is how you can work together interdisciplinary and make sure that we're showing the partnerships and modeling the partnerships they're going to need to be successful when they complete the program. It's also an option for pending students. One thing we've seen with students who may need remedial work is that a lot of times they lose interest because they don't feel the value of what they're doing. They feel like they're taking semester after semester. I want to go into healthcare. I don't want to do 3 semesters of all this remedial work before I can go into healthcare. These are entry-level courses. So some students, while they're completing some of their coursework before they get into the program, they can actually get into courses that they feel are of value to what they want to be when they complete. We're also able to see a stronger program student. For instance, El Centro in Texas, their community college, has had core curriculum since the 90s. They've seen that their students coming into their selective admission programs are very strong in their basic skills. They're being able to spend more time on the specialization within their programs rather than having to reteach the basics over and over and over. Also, flexibility in career choices. We may have students who know they want to go into healthcare. They may start to go towards one program, and then they realize that's not what they really want to do. So what we can do with core curriculum is they can go in, get a taste of the different areas of healthcare education, the different possibilities that they can have, and then maybe they decide, now I have this basic, I may want to go into respiratory instead of nursing, or I may want to go into PT instead of pharmacy. It gives them an option of changing those pathways without being locked into courses that are specific to programs that won't apply to anything else. When we were developing the core curriculum, we used a number of different resources. I mentioned we had partnerships with some of our healthcare employers in the area, brought them in from acute care, long-term care, mental health, different community-based, in a way so we could see above all through all the employees, all the different areas, what do they feel that they may need us to work on in making sure our students are prepared for the workforce when they graduate. We also pulled together allied health and nursing course syllabi into a core curriculum committee that we had formed, which comprised of nursing and allied health together in the committee when we were developing the courses. We looked at El Centro's core curriculum model, which I mentioned they have been using since the 90s and have had great success on their campus in their selective admission programs. We also looked at the Department of Labor Allied Health Competency Model. Eva's going to talk a little bit about that, but it gave us a way to make sure that we were getting the skills and the skill levels that we needed within this education. And then also, we had a great partnership, again, I mentioned earlier, with the Allied Health and Nursing faculty who came together to work on this. I think we have a number of our committee members here today. If you could stand up. You worked on the core curriculum. And I think that what you'll notice if you have questions about core curriculum, if you talk with those that were on the committee, the people that we had within this work are passionate about having core curriculum. I think that through the work that we've done together with looking at other colleges, looking at what the employers needed, they really have came to consider this something near and dear and seeing that this is something that we really feel would be important for our students to have to be successful. So what I'm going to do is I'm going to turn it over to Eva, and she's going to talk about the Allied Health Competency Model.
Okay, it was very fortunate that we did get this model to go by, because at first when the Allied Health and Nursing Committee met, we didn't even know where to start. So we got this model from El Centro, basically, even though it is a Department of Labor Allied Health competency model. And so when we all came together and everybody stood up and you saw the ones that were working together, what we did is we broke down into groups. And we had certain people working on certain courses. So the people who worked on this competency model, I want you to stand up again, and then I want you to tell the faculty members and the core and everybody that's here what you did on your class that you developed. Kevin, you want to start first? Stand up.
It was a long time ago, first of all. So my memory tends to be faulty. When we looked at the competencies for pathophys, which was my charge at that point in time, we really used part of what El Centro had and tied it in with what I'll call role-based competencies that may have varied a little bit from what is here. We wanted to look for commonalities between the roles of a nurse and someone who is going into, for instance, a release of information specialist role, and make sure that their understanding of pathophys was at least somewhat common. We're going to present that in a single course. I hope I covered
That's good.
in part what you're looking for.
Very good. Thank you. And he did a really good job on that too. Chrissy?
Well, I don't want to follow him. Well, Angie, you want to stand up? Angie and I worked together. We did pharmacology and we did communication. And basically what we did, and mine doesn't sound near as cool as Kevin's, is we sat down and we went through all of these syllabi of all the courses and all the different programs. So we went through all the PT stuff, all the rad stuff, all the nursing stuff, and we pulled out things that were similar in everybody's pharmacology courses so that we could create this one pharmacology course that would cover what everybody needed it to cover, and not a lot of that extra really specific stuff that you have in your curriculum that's for your program itself. And then we did the same thing for communication as well. And communication was fun because we got to incorporate all the needs of how important communication is in healthcare. Do you want to add to that, Angie?
Yeah, it really was kind of interesting because everybody agrees it's important, but the amount of importance shifted. RadTech was the most specific, and they talked about communicating with deaf patients and pediatric. So I think we learned as much as we kind of gave back. So it was real. So everybody agreed it was something we needed. That's the one thing we can pretty much get everybody to agree on. Healthcare communication was, something that everybody needed more practice on. So, yeah, it was a lot of fun to look through everybody's different levels of communication, and where it says nonverbal, well, some got more specific, some less specific, but it was pretty cool.
And some people only listed a couple things pertaining to communication, and then there was others that got really deep into it about end of life and how they were going to deal with that communication-wise, and communicating with people of different ethnicities and just very specific things. So
One of the things that I liked about this healthcare communication class that's different than the basic communication class that we offer at the college is that it related to healthcare, which their communication classes offered here. It doesn't go into the healthcare. I mean, many people don't know how to talk to each other out there. So I like that part. So who else can talk about a course? Kara or Eva?
Becky Stevens and I think Stephanie Land worked on this medical terminology course also. We got together and went through the medical terminology course objectives and made sure that they all matched with the healthcare, the competencies that we received. So that's kind of the basic thing that we did with those.
Debbie?
Well, Connie Adams and I worked on the skills, and there's level 1 and level 2 of the skills. So what we looked at first we did that laborious process of going through every course to see what skills are incorporated there. And then we looked at leveling from the standpoint of what hands-on skills do all of the areas and all of the disciplines need. Like, almost everyone needs to know body mechanics, for instance. And everybody does need to know universal precautions. And so that was incorporated into the skills 1, and then skills 2 was a little more advanced from the standpoint of possibly moving somebody with oxygen attached, etc. So that's how the leveling happened. And then, Connie, you may want to speak to it, but after we came up with what we thought was reasonable, we ran it by our committee members so that they could tell us for sure whether or not it was something that their discipline would use or that they would cover.
Connie, did you have anything to say?
Really, that's what we did. I know that we've had several different disciplines teaching in the basic skills course, so I think that was one of the classes that has been successfully multidisciplinarily taught.
Who did the healthcare delivery management? Peggy and James.
Yeah, it's more of the same. And I know that Mary and Dee also did a lot of work with the competency model, and a lot of effort was made. So it's a very large group project.
Did I miss anyone? Okay, thank you all. All right, here's how it looks. This is how it's broken down. I'm gonna come up. We have 6 new courses, and medical terminology was the one that was already existing, but we did kind of tweak it. Basic healthcare skills 1, this is where we teach like vital signs and things like that, so that when those students get into the other programs, you know, you don't have as much to teach because it's already been taught. Healthcare communication, we've already talked about, it's a really good course. The healthcare delivery management is a good course in that the health information technology program can use it instead of one of their courses, and medical billing and coding and medical assisting can use that course instead of one of their other courses. So it is kind of takes the place of another course, and that saves time. The basic pharmacology is taught. It's really been a good course. I think Dwayne Lee taught it first, and he really did a good job. And I think Kara took over, and I don't know where it's gone from there. Pathophysiology, a nursing faculty teaches that currently. And then our basic healthcare skills 2. That's been one of the courses that hasn't, we haven't had as much enrollment as we want, as we have with these others. They get 2 new stackable credentials when they finish these, the basic healthcare foundations and the intermediate healthcare foundations. One of the things that I really did like about when we were developing all this is that it brought the nursing faculty and the allied health faculty together, in which we would have never really had much of an opportunity to mix and mingle. And it brings our students together because they do work together out there in the real world. Our successes is that the core curriculum has been developed and it's been approved for statewide use. KCTCS has 16 colleges. We had a core curriculum summit March 4th at KCTCS, and these colleges participated. We've also got Ivy Tech in the system now, and they're using this core curriculum, which has really been wonderful. And the city colleges of LA. We, this summer, our faculty that are 12-month people had the great privilege of developing these classes online. And we taught them this fall of 2014, again, very successful. As a matter of fact, the enrollment in these online classes have far exceeded the ones that we developed in class. On November, we have a statewide H2P summit, which was very successful. Some of our challenges is that we're trying to take this and create a national movement, and it's moving nationally. I mean, everybody is really on board with it. We've gone to a lot of conferences with everybody from almost every state, and they love this. We're revising existing program curricula to align with the different programs and for the student to be more successful and not have to take so many courses. That's it. Thank you.
Does anybody have any questions? I almost think it's lunchtime. It's just like class, no questions right before lunch. There we go. Just a few little notes before you leave for lunch. Program coordinators, would you like to tell your part-time faculty where your meetings will take place so they know where to go after lunch?
Associate degree nursing will go into the nursing lab, will be in the, I think it's 75, the very end, what we missed last night. PN nursing's gonna be in 444.
Okay, anyone else?
The online program will be here.
Online will meet here, okay. Make sure that you signed in on the sign-in sheet and fill out an evaluation. There are CEUs available for today, so make sure that you do that so you can get your CEU. Lunches are
It's right over here when you first
in
came in.
151, and thank you all for coming this morning. I appreciate it. Thank you very much.
Yeah, we're fine.